Hello, and welcome to Viniyoga therapy for the upper back, neck, and shoulders. I'm Gary Crafso, founder of the American Viniyoga Institute. For the past 3 decades, I've spent countless hours working one-on-one in patient care and trained literally hundreds of yoga teachers, therapists, and health practitioners in the principles of yoga therapy to treat illness and promote health. This DVD features educational content and therapeutic practices for the upper back, neck, and shoulders. These therapeutic practices are based on the same method we used to design the protocol for a National Institute of Health study that successfully demonstrated the effectiveness of yoga therapeutic techniques for back pain relief. Whether you're suffering from occasional or chronic pain in the upper back, neck, or shoulders, whether that pain is mild or intense, or whether you simply want to strengthen your upper back, neck, and shoulders to avoid future problems, I hope you find these practices useful. In this DVD, there are 3 practices. 1, focusing on the upper back and neck and the relationship between the upper back and neck. 1, focusing on the neck and shoulders and the relationship between the neck and shoulders. And the 3rd practice, integrating the first 2 and adding some stronger things. The first practice is very good for people that are having problems in their upper back and their shoulder girdle. People who feel that their shoulders never sit correctly in their upper back. They have random or very specific pains in their upper back or in their shoulders. Both people who have a flattened upper back and people that have a excessively kyphotic upper back, people that have ongoing shoulder problems. This practice is about 20 minutes long. The second practice that's focused on the neck and shoulders is very particular for that relationship between the neck and shoulders. People that have pain when they turn their head, limited motion when they turn their head, and limited motion in their shoulder girdle or pain when they move their shoulders. This practice is also about 20 minutes. Both of these are therapeutic practices that are designed to work with conditions of pain, discomfort, limitation, and movement. The third practice of this DVD series integrates many of the postures from the first, upper back and neck, and the second, neck and shoulder practices, plus adds some stronger postures. This practice is designed to significantly strengthen the relationship between your upper back, neck, and shoulders and increase range of motion. It's thought of as a preventative practice to avoid recurring future problems and should be used once you start feeling stronger and free from pain. Now, if you have disc herniation, spinal stenosis, spondylosis, or spondylolisthesis, or any other acute symptoms that may be the result of injury or disease, I caution you not to practice any of these sequences without the guidance of an experienced therapist. These practices, especially the first 2 shorter practices, can be very helpful for many conditions of pain in the upper back, neck, and shoulders, even more serious conditions. But they should be done cautiously and with the guidance of someone who's experienced. As you begin to use these practices, I'd like you to notice, first of all, the effect that you feel immediately after the practice and for the next hour or 2. There's a time release effect. But continue to practice consistently because there's a cumulative effect in using these practices, much like in oral hygiene, brushing your teeth and using dental floss, which you can do every day, even twice a day for the rest of your lives. These practices are designed for consistent usage, and they can be done on and on and on, over and over again. And they will have a very positive cumulative effect in maintaining the integrity of your upper back, neck, and shoulders. So use these practices and enjoy. So I'd like to define for you all 4 fundamental principles that are important to understand in applying these practices for the Viniyoga approach to yoga therapy. The first principle is the relationship between breath and movement. In yoga, if you remember earlier in the DVD, I mentioned that the fundamental principles of the yoga process include awareness, breath, and movement. So the gift of the breath is that it enables us to feel more intimately the movement of the spine. And also the breath will activate the movement of the spine. It's not the breath itself, of course, it's the fundamental muscles of respiration, particularly the diaphragm, the intercostals, and adjunct muscles for the inhalation would be the erector spina. And on the exhalation, we're intentionally engaging the abdominal rectus muscles. So for the sake of the practices in this DVD, this is not a global statement about breathing in yoga, but particular to the structural therapeutic orientation of this DVD, I'd like you to think about inhalation and primarily the expansion, horizontal expansion of the thoracic cavity and the vertical extension of the spine. The idea will be to focus the inhale in expanding the chest and feeling the ribs lifting vertically away from the pelvis. I'll give you a frontal demonstration of this kind of inhalation that I'm talking about. So if you noticed, as I began to inhale, my chest expanded. I was lifting my sternum vertically up and away from my navel. So there's a slight stretching in the front of the body. If I give you a profile view, and I'll exaggerate a little bit so that you can see that action. What you can notice is that in quick time, I lifted my sternum away from my navel, and the effect was that my upper back flattened and my ribs lifted vertically away from my pelvis. So this kind of inhalation promotes the natural axial extension of the spine. That's the gift of inhalation. So for the exhalation, I want to give a demonstration from a frontal view, but I'll use my hand to support what's happening so you can see what's happening. Consider that my pinky represents the insertion of my abdominal rectus muscles into my pubic bone. And then as you move up my hand, the fingers, the thumb is the origin of the abdominal rectus here up at the sternum. And as I exhale, I'll contract the fingers in an upward flowing way so you can see what I'm doing with the muscles of the abdomen. So at the end of the exhale, I'm still holding my belly from my pubic bone to my sternum firm. When I inhale, I expand my chest. And then begin to relax the abdomen from the sternum down to the navel. I'll show you a view of this exhalation and inhalation from a profile. I won't use my hand. I'll exaggerate the action that exhalation creates in the pelvic-lumbar relationship, which is important in the practices that we're using for the therapy, especially for the low back. So as I exhale, you'll see, and I'll show with my hand, the action of my pelvis. My belly comes in, my pubic bones lifted slightly, my hip bones drop down, and my erector spina are stretched. So if I combine inhale and exhale and exaggerate, this is an exaggeration, the action in the spinal curves, I'll increase my lumbar lordosis and increase my thoracic kyphosis. Inhalation. And exhalation. Inhalation and exhalation. The idea then is to use the inhalation and exhalation to integrate the spinal curves. Inhale again, primarily expansion of the chest, flattening of the thoracic kyphosis, axial extension of the spine. exhalation, primarily stabilizing the pelvic-lumbar relationship, also stretching the low back. Now, I had talked about awareness, breath, and movement. So the next point is how to actually do an individual posture. The starting point is to have a clear intention for each posture. For example, the practices in this DVD, you can see the intention in the workshop section of the DVD of every posture. When you have a clear idea of the intention, you direct your awareness through attention to the breath. Then through the breath you mobilize the spine. As the spine begins to move, the limbs of the body move in relationship to the movement of the spine. So it's awareness, breath, movement of the spine, movement of the limbs. This is the focus during an individual asana. Now, when we're doing individual asanas, in particular in this DVD where the orientation is specifically structural benefit, we're using a lot of repetition. That is, each posture begins in a neutral starting position, then the posture begins by the movement of the spine and the limbs to the main posture or to the form of the posture, and then you return to the neutral starting position. Many people think of yoga as just static postures, but the teaching of this tradition, the Viniyoga teachings, and as well the insight of modern Western exercise physiology, is that to effect significant structural change, repetition is a powerful tool. For example, when I bend forward, the muscles of my back stretch. When I come up, those same muscles contract. In order to change the condition of the muscles, it's not simply a matter of stretching them, but it's alternating stretching and contracting. This creates what we call in Western physiology proprioceptive neuromuscular facilitation, abbreviated as PNF. That means more circulation, the muscles get more relaxed and yet stronger. The yogis recognized this. The ancients knew that in order to effect change in the body, repetition was the most effective means. The static postures have very deep, even physiological effects, and we use them especially when we're doing yoga therapy for chronic disease and psycho-emotional well-being. But for structure, repetition is very important. Still in the discussion of how to do an individual posture, the third thing that I find very important to mention here is the topic that I call the adaptation of the forms of the postures. In the yoga world, for example, many people have the notion that each posture has a correct form, and the way to practice the posture is to master the form of the posture. In Viniyoga, we talk about the functional effects of postures, and we adapt the form of the posture to serve the particular function we're trying to achieve. For example, if you look at the practices in this DVD, you'll see in each sequence certain postures that are repeated throughout. However, if you practice them, you'll feel in your own bodies that the postures are done in different ways. The adaptation of the forms of the postures in each DVD is related to the specific intentions of the practice. So in one posture, you're doing it to stretch the back. In another DVD, that same posture, you're doing it to activate the muscles of the shoulder girdle or to stretch the neck and shoulders. So this idea of liberating you from what I sometimes jokingly call the tyranny of the form of the posture, and be able to have the freedom to adapt the form of the posture to produce particular and different effects in your body, it's important to understand when you begin these practices. Finally, the last point I'd like to discuss with you is that there's an art and science of sequencing, also known as vinyasa krama, used in this methodology of practice. The principle is very important that each individual posture by itself may have a theoretical effect, but the way in which you combine the postures changes the effects of the same postures. So there's a science behind the sequences that are in these DVDs. All the different practices are intentionally placed in specific orders, and the effect of the same postures would be very different if they were placed in different order. Much like vocabulary in sentence structure. You change the order of the words, you change the meaning. So different sequence combinations produce different effects. So I'd like to just review these 4 points for you that are so important in this methodology of practice and in yoga therapy in general. One is the primacy of the breath and the fundamental focus of the relationship between the flow of the breath and the movement of the spine as you do each posture. 2, become clearly aware of the intention of each posture, then link your awareness through attention to the breath and link the flow of breath to the movement of the spine, and from the movement of the spine, the movement of the limbs. The next point is that in these practices, we're not just staying in postures, but we're moving into and out of in a very particular way, with a very particular intention in relation to the muscles that we're working in the practice. 3, don't be surprised by the same posture done in different ways. There's not one correct way to do a posture. The correct way to do a posture is the way that maximizes its functional benefit for your bodies. And the last point, again, is just please, when you practice these sequences, follow the order. It's a very carefully thought out sequence. There's nothing arbitrary or random about it. Hello, thank you for being here today. I'm Gary Krafso, and today we're going to talk about Viniyoga therapeutic approach to working with upper back, neck, and shoulder problems. Now, back problems in general, and upper back, neck, and shoulder problems in particular, are widespread. In fact, the statistics show that 8 out of 10 people will experience back pain sometime in their lives, and that back pain itself is the most common cause of job-related disability. In addition, about 14 million people seek medical care for shoulder problems annually. In the US, back pain in general, including lower back, upper back, neck, and shoulder pain, costs over $100 billion a year. Now, the most common way that people deal with these problems include exercise, physical therapy, medications, and surgeries. And in addition, there are alternative healthcare practices such as acupuncture that have been very helpful. Now, despite the literally billions of dollars spent annually on these problems, they persist. But fortunately, Western medicine is beginning to appreciate the ancient yoga system. The National Institute of Health sponsored a low back pain study, which I designed the protocol for a few years ago. And in December of 2005, the results were printed in the Annals of Internal Medicine, which is a prestigious peer-reviewed medical journal. That study showed that Viniyoga is a safe and effective treatment for chronic back pain, that yoga itself is beneficial because it involves physical movement, but also because of its emphasis on mental focus, and finally, that yoga is going to be more effective than exercise classes in resolving these back pain issues. Now, this study was specific for low back pain. However, in this DVD, you'll see the application of the same methodology that I've used for decades very successfully with upper back, neck, and shoulder problems. So what is this thing that we call yoga? You know, yoga is an ancient word, and it has many meanings used in many different contexts. So for the sake of the material that we're going to cover in this DVD, let's think of yoga as a process of self-understanding and self-development that's oriented towards reducing the symptoms and causes of suffering at any level that it may appear in your system, whether it's structural pain or the suffering from chronic illness or even emotional disturbances, and oriented towards developing positive qualities in oneself and increasing one's health and happiness, increasing one's self-confidence and state of well-being. Now, the process of yoga begins with awareness and self-awareness. And for the exercises that we use in this DVD, the next step is linking that awareness to the flow of the breath and the ability to deepen the inhale and lengthen the exhale. The next point is to link the flow of the breath to an awareness and to the mobilization of the spine. The breath helps us to become more aware of the spine and helps us to mobilize the spine. And as the spine moves, we then move the other limbs of the body, extending out from the movement of the spine. What is yoga therapy? The yoga therapy process uses yoga techniques for the treatment of specific ailments. This can be applied to structural problems, or working to manage symptoms of chronic disease, or working to help someone who's suffering from emotional disturbances. So the general structural goals of yoga therapy that we're going to be using in the practices in this DVD include, first of all, the reduction of pain and also inflammation. Then the increase of circulation. Increasing circulation, it's through the circulation that the tissue that's been damaged will heal. Also improved function. And finally, an increased sense of self-confidence and well-being. So to put it very simply, there are two main goals in yoga therapy: reducing the negative, which in this case can mean pain and inflammation, and increasing the positive, which in this case means improved function, greater self-confidence, greater sense of well-being. Now, specific to the work in this DVD is the Viniyoga methodology, which uniquely emphasizes these 3 points. The first is differentiation. By differentiation, what I mean is the ability of the therapist or the practitioner to identify the unique individual nature of the condition that is being worked on, then the adaptation of the tools of yoga that can be used to help remedy the problem, and then the appropriate application of those tools to match that individual condition that's being differentiated. These principles of Viniyoga are ancient and have been passed from teacher to student for thousands of years. I personally have been working with this methodology for over 30 years and have done thousands of hours of one-on-one patient care quite successfully for these kinds of conditions. I'd like to talk with you about the kinds of pain or types of pain that you may be experiencing. The first kind of pain is chronic pain. Chronic pain can be constant or intermittent, but it's measured by duration. It goes for days, weeks, months, sometimes even years. The next type of pain is what is called acute pain. Acute pain is measured by a degree of intensity. Now, both chronic and acute pain have sensations that range from dull to sharp, even electric, and even incapacitating. Pain will limit the range of motion, create loss of function, and in addition, there are other symptoms, more serious symptoms like numbness, tingling or weakness, shooting pain down the arm and into the hand. If these kinds of problems are present, please consult a primary care provider before you continue with the practices in this DVD. So now I'd like to talk with you about the causes of upper back, neck, and shoulder pain. But because there are so many causes, we're going to organize the information in 3 categories. The first category is disease. Disease is a causal factor in some of the more serious kinds of pain in the upper back, neck, and shoulders. The first is spinal stenosis. Spinal stenosis is a narrowing of the nerve passage in the spinal canal, which then creates nerve impingement and causes pain. Spondylosis is a degenerative and inflammatory condition of the bones of the spine. Cervical spondylolisthesis is a condition of joint instability where one vertebra slips forward of the other, causing nerve impingement, which causes pain. And then there are the unfortunate conditions of cancers and tumors, which can create spinal pain, as well as infections like spondylitis and osteomyelitis, which are infections of the joints and the bones of the spine. Also, there's age-related and non-age-related degenerative disc disease, and osteoporosis, which is a metabolic disorder which is characterized by bone density loss, and osteo and rheumatoid arthritis, as well as fibromyalgia. Osteoarthritis is a metabolic disorder that causes breakdown of the joint cartilage. Rheumatoid arthritis, instead, is an inflammatory condition related to an immune disorder. And fibromyalgia, also an autoimmune condition which is characterized by widespread trigger point pain throughout the body, including the upper back, neck, and shoulders. The second category is pain as a result of injury. The first is, of course, traumatic accidents. These can be falling accidents or automobile accidents that result in conditions like whiplash. So next we have repetitive stress injury, which happens from all sorts of daily life activities, work activities, even sport activities. After repetitive stress injury, we have conditions like bursitis, which is the inflammation of the fluid-filled sacs called bursa between the tendons and the bones. Then there are rotator cuff injuries, very widespread common condition, which we'll talk about more later. In addition, there is this case of the separated shoulder, which is damage to the ligaments that connect the collarbone to the scapula, and also shoulder dislocation, where the ball-shaped head of the arm comes out of the socket at the shoulder joint. And in addition, there are the muscle sprains or spasms and ligament and tendon strain, including tendinitis. Finally, we have the conditions of bulging or herniated discs, which in the neck are very, very serious. And if you have herniated cervical disc, please see a primary health care provider before you proceed with the practices that are on this video. The third category of causes of upper back, neck, and shoulder pain are mechanical issues that relate to skeletal misalignment. Skeletal misalignment can be related to congenital birth conditions in the shapes of the bones or developmental as we grow. In relation to skeletal misalignment, you also have conditions of muscular asymmetry. Again, they can be developmental because of congenital structural imbalances, or they can be developmental as a result of asymmetric lifestyle, sports activities, or work activities. In addition, we have the condition of what's called hyper or hypotonic muscles. A hypertonic muscle is a muscle that's in a state of chronic contraction, subliminal muscular contraction, which then blocks circulation and can even cause nerve impingement and therefore pain. And the hypotonic muscles, which are weak muscles that don't have any real contractile strength. Another important cause of pain to the upper back, neck, and shoulders are dysfunctional movement patterns that we've acquired since childhood that themselves are causally connected to repetitive stress injury. Another condition is shoulder impingement, which is when the tendon is trapped under the bone, and shoulder impingement leads to conditions like bursitis and tendinitis. The next is nerve impingement, including thoracic outlet syndrome. Thoracic outlet syndrome is when a nerve is caught between the collarbone and the first rib. I often call thoracic outlet the sciatica of the shoulder girdle. There's also the condition called frozen shoulder, also known as adhesive capsulitis. Frozen shoulder is a condition of the muscles and connective tissue that results when the shoulder is immobilized or the arm is immobilized for extended periods of time. And then afterwards, it's very painful and stiff, and it's very difficult to move the shoulder. And finally, and in some sense the opposite of frozen shoulder, is the condition of joint hypermobility, where there's excessive range of motion and instability in the joint. These are all causal factors in upper back, neck, and shoulder pain. Now remember the definition I gave you of the yoga process, beginning with awareness and self-awareness. In order to effectively work with upper back, neck, and shoulder pain, it's helpful to understand the biomechanics of the upper back, neck, and shoulders. We're going to begin by looking at a posterior view of the axis of the spine. First we have the cervical spine, which has 7 vertebral bodies, and then we have the thoracic spine, which has 12 vertebral bodies, followed by the lumbar spine and the sacrum. Now, relative to the upper back, if you look closely, you'll see that you have the rib cage, the ribs, connected to the processes of the thoracic vertebra. This creates a very stable structure, which means that most upper back pain is not related to disc herniation, spinal stenosis, or spondylosis. More likely are joint complications between the ribs and the thoracic vertebra. Now let's turn to the appendicular skeleton, which includes the shoulder girdle and the arms, and the pelvic girdle and the legs. Understanding the appendicular-axial relationship in your own body will be very important in working with the upper back, neck, and shoulder pain that you may be experiencing. Now we're turning our attention to a profile perspective of the axial skeleton to look at the spinal curves and their functional relationship. This green line shows healthy spinal curves. The thoracic curve is called the thoracic kyphosis, and this orange line shows excessive thoracic kyphosis. Another condition of the thoracic spine is where the thoracic spine loses its curve and flattens. The yellow line shows the lumbar lordosis, an excessive exaggeration of lumbar lordosis. Also, there is the condition of loss of lumbar curve, flattened lumbar spine. Now let's look at the axis of the spine from a posterior view. This demonstrates vertical alignment, the healthy condition of the spine. And this yellow line indicates the lateral displacement of the spine known as scoliosis. Almost all of us have some degree of scoliosis. Scoliosis can go from just a minor misalignment to an extreme misalignment that requires surgical intervention. But any degree of lateral scoliosis can be a causal factor in upper back, neck, and shoulder pain. Another important factor in understanding upper back, neck, and shoulder pain is the alignment of the shoulder girdle relative to the vertical axis of the spine. This represents a balanced relationship between the shoulder girdle and the thoracic cervical connection. This drawing represents an elevated shoulder or a depressed shoulder. Most of us, if you look in the mirror, you'll see one shoulder a little higher than the other. Another factor is the forward or backward rotation of the shoulder girdle. This same condition exists in the pelvis, and the condition of elevated and rotated pelvis can be a causal factor in the imbalance in the shoulder girdle. Now we're going to turn our attention to the bones of the shoulder girdle. If you'll notice, there's actually only one bony connection that attaches the shoulder girdle to the torso. The rest is connected by soft tissue. In addition to these fundamental bones, we have the ligaments of the shoulder girdle. Notice this AC ligament is the one that's damaged in the condition of separated shoulder. Now let's take a closer look at the rotator cuff, an area where there's very common injury. The bones of the rotator cuff, as well as the ligaments of the rotator cuff, and the major muscles of the rotator cuff. The rotator cuff muscles and tendons both dynamically stabilize the upper arm and mobilize the upper arm, allowing a wide range of motion. It's the most mobile joint in the body. Swelling, inflammation, tearing, or any bony changes around the rotator cuff tendon or the muscles themselves is a major cause of shoulder pain. So now let's turn our attention for a moment to the musculature of the neck, looking at both the innermost layer of muscles, then the middle layer of muscles, and then finally the most superficial layer of muscles. The important thing to consider with the muscles of the neck is the tremendous tension, chronic tension that we all carry in our neck, that itself leads to so much of the neck pain that we experience. These are the muscles of the upper back and shoulder girdle. These muscles help maintain the integrity of the upper back and shoulders and mobilize the arms, and we use them regularly in daily activity. These are also the muscles that we're going to be utilizing in the practices that follow to help restore healthy condition in the upper back, neck, and shoulders. With a basic understanding of the biomechanics of the upper back, neck, and shoulders, including the bones, the ligaments, the joints, and the muscles that mobilize these parts of the body, we'll turn our attention to the specific goals of yoga therapy related to upper back, neck, and shoulder pain. First and foremost is improving postural alignment. We also want to work to increase structural stability. This is particularly important in the neck and shoulders. In addition, We want to increase range of motion, for example, when we have the condition of frozen shoulder. It's also very important to strengthen weak muscles and to identify and release muscles where there's chronic contraction. In addition, we want to use the practices to help restore muscular symmetry, and finally, to develop healthy, functional movement patterns. It is the intention of the practice that follow in this DVD to help you achieve all of these goals. We hope you enjoy the practice.